Hi, my name is Destiny Harber, and this is my informative speech presentation for business and professional speech. Today I'll be covering infant nutrition from conception through toddlerhood. And I do say conception on purpose because whenever mothers become aware of their pregnancy, it's recommended they start taking prenatal vitamins and they start becoming more aware of their diet to prepare for a healthy baby and a healthy delivery. And this also helps prepare new mothers for breastfeeding because a healthy diet is essential for breast milk production. It's recommended as the sole source of nutrition for infants from birth through age 6 months by the American Association of Pediatrics and the CDC. It is recommended to exclusively breastfeeding and supplementing with bottled breast milk and through pumping can make it a viable option for working mothers and make it a feasible option. Vitamin D supplementation is usually recommended for breastfed infants because moms and babies don't go outside as much, and it can help with their proper bone development and combating jaundice, which is the yellowing of the eyes and skin. There are many health benefits for both the mom and the baby because it's formulated for your baby's specific individual needs. When a baby nurses, there's a saliva exchange through the skin for the mother, and the constitution of the breast milk actually changes as the baby grows and develops. Baby has a decreased risk for colds, viruses, ear infections, and more serious issues such as asthma and diabetes. And there's also a decreased risk of sudden infant death syndrome by more than 40%. There's also benefits for the mother, including reduced risk of cancer such as breast cancer and uterine cancer, ovarian cancer, diabetes, and high blood pressure. Breastfeeding doesn't always work for mothers or babies, and there is formula as an option, whether it's from a NICU stay or just because the mother chooses not to continue breastfeeding. Commercial infant formula is regulated by the United States Food and Drug Administration to make sure the calories and nutrients and vitamins are all there that your baby needs, and it's a viable option. But there is no homemade option. Even with the current formula shortage that is making these homemade recipes more prevalent, they're not safe, and goat's milk and Karo syrup does not have the nutritional content that your baby needs. The only homemade formula is breast milk. Whenever your baby starts showing interest or in foods after 6 months, as recommended by the CDC and La Leche League International, they'll start showing signs of readiness to transition to solids. Signs of readiness can include being able to sit by themselves, full control of their neck and head. They start showing interest in food, following food with their eyes, trying to take your food, and they're able to grasp, whether it's grasping toys, in order to be able to grasp food. And then they start bringing their hands to their mouth. And whenever you start to feed babies, whenever babies nurse, they have a tongue thrust reflex to prevent them from choking if they're not ready. And whenever that is reduced, they'll start bringing the food from the front of the mouth to the back of the mouth to be able to swallow. And that is the main sign to watch for that they're ready to start solids. Whenever you start solids, you want to start with infant cereal and mixing it with either breast milk or prepared formula and feeding it with a spoon. It's not safe to put anything in a bottle besides breast milk or prepared formula because it can cause the baby to aspirate, and that's not safe. Whenever you start introducing solids, you want to start with single ingredient solids, one at a time with a few days in between. That way you can watch for allergic reactions. High allergen foods include milk, nuts, seafood, shellfish, and eggs. Signs to watch for can include rash, hives, bloating, constipation, general gas, fussiness, and in severe cases, anaphylaxis, which can be life-threatening. And whenever you start transitioning to solids, honey is not a safe food until after 1 year of age because it has increased risk of botulism. Once you have went through these single ingredient foods, the next stage is to transition your baby to table foods. And this can be whether it's modified versions of what you're eating, whether it's mashed or cut up in smaller portions, or pre-made options that the store has. And this is toddler nutrition or infant nutrition through toddler. Thank you.